Hi there. Today, we are discussing everything you need to know about antenatal care. Introduction. Antenatal care, ANC, refers to the regular medical and nursing supervision of pregnant women before childbirth. Its primary goal is to ensure the health and well-being of both the mother and the developing fetus. ANC offers a platform for risk identification, disease prevention, health promotion, and the preparation for childbirth and parenthood. What are the objectives of antenatal care? 1. To monitor the progress of pregnancy to ensure maternal and fetal well-being. 2. To detect high-risk conditions and complications early. 3. To provide education on nutrition, hygiene, and lifestyle. 4. To prevent and manage common pregnancy-related problems. 5. To promote safe delivery and prepare the mother emotionally and physically. 6. To encourage skilled attendance at birth and postnatal follow-up. What are the components of antenatal care? 1. Early registration and scheduled visits. Pregnant women should register for ANC as early as possible, ideally within the first 12 weeks of pregnancy. The World Health Organization, WHO, recommends at least 8 ANC contacts during pregnancy. Regular visits allow continuous monitoring of the pregnancy and timely detection of complications. 2. Medical and obstetric history taking. A detailed history is essential to identify risk factors such as previous obstetric complications, chronic illnesses, e.g. diabetes, hypertension, or family history of genetic disorders. Social and lifestyle factors like smoking, alcohol use, and domestic environment are also considered. 3. Physical examination. General examination includes assessment of blood pressure, weight, and nutritional status. Abdominal examination helps assess fetal growth, position, and movement. Pelvic examination may be done in some cases to assess the birth canal, mostly close to delivery. 4. Laboratory investigations. Blood tests. This includes hemoglobin, for anemia, blood group and Rh type, HIV, hepatitis B, syphilis. Urinalysis, for detecting protein, preeclampsia, sugar, gestational diabetes, and infections. Ultrasound, used to confirm gestational age, detect multiple pregnancies, monitor fetal development, and identify structural abnormalities. 5. Nutritional care and supplementation. Pregnant women require a well-balanced diet with increased calories, iron, calcium, folic acid, and other micronutrients. Iron and folic acid supplementation is provided routinely to prevent anemia and neural tube defects. Calcium supplements help prevent pregnancy-induced hypertension and support fetal bone development. 6. Immunization. Tetanus toxoid, TT, immunization is a critical component of antenatal care aimed at preventing maternal and neonatal tetanus, a life-threatening condition caused by Clostridium tetani infection, often acquired through unclean delivery practices or contaminated umbilical cord care. Neonatal tetanus is responsible for thousands of newborn deaths globally, especially in low-resource settings. Immunization of pregnant women ensures passive transfer of protective antibodies to the fetus, safeguarding the newborn until they can receive their own vaccinations. TT also protects the mother from tetanus during childbirth, especially if delivery is done under non-sterile conditions. Recommended TT immunization schedule is shown on the screen. Note, if a woman has previously received all 5 doses, no additional doses are needed in subsequent pregnancies. TT is administered as an intramuscular injection in the upper arm, deltoid. Safe to administer at any stage of pregnancy, though earlier is better to allow time for antibody development and transfer to the fetus. 7. Health education and counseling. During ANC visits, women are educated on warning signs in pregnancy, e.g. bleeding, severe headaches, swelling. Personal hygiene and infection prevention. Importance of rest and safe physical activity. Birth preparedness and emergency planning. 8. Preventive malaria treatment. Malaria during pregnancy is a major public health concern, especially in sub-Saharan Africa and other malaria-endemic regions. It increases the risk of maternal anemia, miscarriage, stillbirth, premature delivery, and low birth weight, a leading cause of neonatal death. Therefore, intermittent preventive treatment in pregnancy is a key strategy in antenatal care. It involves giving pregnant women curative doses of anti-malarial drugs at scheduled intervals during pregnancy regardless of whether they have malaria symptoms or not. The World Health Organization recommends sulfadoxine pyrimethamine, SP, as the drug of choice, given as a single dose of 3 tablets taken orally under direct observation, to all pregnant women in areas of moderate to high malaria transmission, starting in the second trimester, after quickening, usually around 13 weeks gestation. It is not recommended for women in the first trimester or those who are HIV positive and on cotrimoxazole. Dosing schedule: the first dose is given as early as possible in the second trimester. Subsequent doses is given at each scheduled antenatal visit, at least 1 month apart. A minimum of 3 doses is recommended, but more, up to 5 or more, improves outcomes. Other preventive measures include use of insecticide-treated mosquito nets, vector control and prompt diagnosis and treatment of malaria symptoms. 9. Psychological and social support. Antenatal care includes mental health screening for anxiety, depression, or domestic violence. Counseling on emotional changes in pregnancy and support systems available. Encouraging involvement of partners and family in antenatal education. 10. Birth planning and postnatal care preparation. During ANC, plans for the place of delivery should be made, transportation, and costs are also discussed. Education on breastfeeding, newborn care, and the importance of postnatal follow-up is provided. Barriers to effective antenatal care. Lack of access to health facilities, especially in rural areas. Socio-cultural beliefs and gender norms. Financial constraints. Poor awareness about the importance of ANC. Shortage of trained healthcare providers. Conclusion. Antenatal care is a cornerstone of maternal and child health services. When effectively delivered, it contributes significantly to the reduction of maternal and infant mortality. Governments, healthcare systems, and communities must work together to ensure that every woman receives timely, respectful, and comprehensive antenatal care throughout her pregnancy. Thanks for listening. Please ask your questions in the comments section. Like, share, subscribe and turn on notifications so you don't miss out on educational videos like this.